I'm so happy that I know I have completed 350 subscribers, and it's a great thing that it's been 12 days or maybe 15 days that since I started this YouTube channel, but I am receiving so much support and I'm so happy for that. I'm so thankful to each one of you, and I got many messages through Instagram, and I have responded most of you that whatever you asked, whatever the query you had, I helped a little bit what I can, and that's all I have to say. And I'm so thankful. Keep supporting me, and I can make this PPT presentation and I can put it here. But I just wanted to keep connected with you people where you can think that I'm not anything big and I'm not any certified podcaster or instructor. I'm just a quality analyst where what is there here, what is there in my brain, I'm just putting it out, and I am thinking it may help you in some sort of sense. And I just want to keep it simple. When you take things in a simple way, it's realistic. It really feels simple. I can say today is a modifier session and I can put this much PPTs and this much theory part and I can go through all the theory. That is not my type. I will give you simple examples and I will give you just to tips to tackle the scenario where you can easily understand. So today I'm going to discuss all the modifiers, which is very important. I mean appendix A modifier, which is really important for billing purpose, and I'm keeping it very simple and you all going to love it. I am thinking like that. I don't know what's going to happen. So let's get started without wasting time. So what is modifiers? Some procedure have been performed, has been altered due to some specific circumstances, but it's not changing in its code or description. So we will use modifier to show some alteration has been done while doing a procedure. Just to reflect the alteration, we are going to use modifier so that it should not affect in billing, or insurance provider will get paid what he really worked or what he deserves for the service. So this is a thing. When you are referring modifiers, don't refer from front of the CPT book. You have to go to page number 917 in 2022 CPT book. You will find appendix A modifier with this much description. So refer from there so you will get to know better about modifier sections. So today I'm going to discuss important modifiers. Some 10 modifier I will discuss today. Later I will when I get time I will make a part 2 about this modifier. So 22 modifier says increased procedural service. That means, for example, one procedure need 30 minutes, but provider took 60 minutes due to some complication from patient side or some specific circumstances. He worked 30 minutes extra. That is, he took more time than usual, longer than usual. So we should show that provider worked extra than usual time. We are going to append 22 modifier. So he will get paid for the work he did extra. So 23 modifier, it says unusual anesthesia. That means some procedure require no anesthesia or it may require local anesthesia, but due to some unusual circumstances or from some scenarios, provider going to perform anesthesia. In that case, we are going to append 23 modifier. So coming to 24 modifier, it says unrelated evolution and management during post-operative period. First, you should know what is post-operative period. For some procedures, they will have global surgical package. That means patient came some 5 days back for abscess on hand. So provider performed incision and drainage. For that particular CPT code, 10 days global period. In that 10 days, if patient coming back for anything related to abscess, provider should not charge for that because it is included in post-operative period. So this is post-operative concept. So when we are going to append 24 means, as I told 5 days back, procedure, abscess procedure, incision and drainage procedure done. So but now patient having some severe abdominal pain, he is coming again to the same specialty and he wants examine his body, I mean he wants evolution. So provider going to evaluate him, he will provider perform physical examination and he will everything related to evolution and management. Here he may come in post-operative, but the condition is unrelated to the current procedure which has already been done. Abscess done, but patient now having severe abdominal pain, it is totally unrelated. So we are going to append 24 modifier to EN. So coming to 25 modifier, which says significant separately identifiable ENM. For example, patient may be coming for fever or maybe vomiting or maybe some laceration. So provider going to perform evolution and management. With that, provider also going to perform injection or maybe some laceration repair. So to distinguish that procedure, to separate procedure, we are going to give 25 modifier to E&M, where it shows something other than evolution and management has been done, some other procedure also done. This is 25 modifier concept. You should know, you should know that 25 modifier with 99 series you can append. So 26 modifier, which says professional component. For example, patient came to hospital A and this hospital A physician asked hospital B physician to review and give interpretation of this particular patient. At that time, in scenarios, they will ask, how would you report hospital B physician service? So it is a professional component. This hospital B physician going to perform professional component. So we are going to append 26 modifier, and you should remember that we will give 26 modifier only with 7 series and 8 series. This is professional component and 26 modifier concept. Coming to 47 modifier, which says anesthesia by surgeon. For example, patient came to hospital, there is an emergency and provider should perform some surgery, but there is no anesthesiologist around. So what provider going to do, what that surgeon going to perform anesthesia to that patient. He is going to induce anesthesia to patient. So to report that, we will use 47 modifier with surgery codes. That means 1 to 6 series CPTs. We will use this 47. It says anesthesia by surgeon. So this is 47 modifier. So next will be 50 modifier, which says bilateral procedure. That means any procedure which is done bilaterally, both right and left, we are going to append 50 modifier to that particular CPT. For example, removal of serum from both the ears using irrigation or maybe curettage, we will append 50 modifier to that particular CPT, and which it says procedure done bilaterally. This is 50 modifier. I think it's very easy and it's simple to understand. Coming to 52 modifier, which says reduced service. That means some procedure codes will have, some procedure has to be done bilaterally, but provider going to perform it, provider perform partially. He may reduce the procedure or he may done unilaterally. That says 52 modifier. So we will append 52 modifier to that particular CPT. And this is 52 modifier concept. 51 I already explained in another video, which please go through that video. Next will be 53 modifier, which says discontinued procedure. That means when physicians start doing surgery, patient may not tolerate well, or patient may start bleeding, patient may get low BP, some complication from the patient side. Provider decide to terminate the procedure. Okay, this patient is not tolerating well, will terminate this procedure. So in that scenarios where they mention, like where that scenario tells procedure has been terminated, we can append 53 modifier. So this is 53 modifier concept. 57 modifier which says decision for surgery. For example, patient met with a severe accident and they brought patient to hospital, and by seeing the patient, surgeon decides this surgery has to be done. So that kind of sudden decision, in scenarios like that, we are going to give 57 modifier and 50. So that's all for today. I have explained some important modifiers which really important, and other set of modifiers I'm going to explain it later, because she's not leaving me to do video, she's asking food. And thank you so much whoever supporting me, and please keep supporting me, and I'm definitely I'm going to share everything that I know. I will learn and I will let you know people also. And what is that, I want to stay connected in this media where I can reach medical coders easily, or medical coders can reach me easily. And I'm so happy that the support I'm getting from you people. And what I can say, I'm so happy. Thank you, thank you, thank you, thank you. Say thank you. Thank you. Please subscribe our channel.